In this video, we'll learn about lens examination. What are the points that you will look at and how do you present them? So there are four components that you would look when you're examining the lens: the position, the shape, the color, and presence or absence of iris shadow. So first is the position. Okay, so normally the lens sits behind the iris in the posterior chamber, and it is being held by the zonules. So behind the lens is the vitreous, and the anterior iloid face, there is a depression called the patellar fossa in which the lens sits. This is the normal position of the lens. Okay, the normal lens is placed in the patellar fossa. Now, if the lens is displaced from this patellar fossa, partially or completely, we call it as subluxation or dislocation respectively. So if it is partially displaced from the patellar fossa, part of it is still in the patellar fossa, but it is not sitting in the center, we call it as subluxation. If it is completely displaced from the patellar fossa, we call it as dislocation. So if it is partially displaced from the patellar fossa, we call it as subluxation. So when you see from front, you will see part of it as lens, part of it is aphakic. In dislocation, it is completely dislocated from the patellar fossa. So when you see in from front, you see as aphakia. But this dislocation can be anterior, where it is in front of the iris, where it is dislocated into the anterior chamber, or it can be dislocated into the vitreous, right? So what are the causes? Most common cause is trauma, but we also have conditions like ectopia lentis, where in Marfan syndrome, Weil-Marchesani syndrome, or homocystinuria, you'll see subluxation of the lens. Now, coming to the subluxation, as we already learned, subluxation is partial displacement from patellar fossa. Dislocation is complete displacement from patellar fossa. So, what are the so when you see in subluxation, you will see that from the front, you'll see that partially the lens is there, partially in the pupillary area, and there's an area which is aphakic. So, what would be the complaints of such individuals? It will be probably blurring of vision, and if it is a partially displaced clear lens, then the patient might experience uniocular diplopia. So subluxation is one of the reasons for uniocular diplopia. In dislocation, what happens, as I told you earlier, it can be either anterior dislocation, where it's displaced into the anterior chamber. You can see the whole lens in the anterior chamber. Or it can be posterior dislocated, where you see it as aphakia, right? So what are the causes? For subluxation, the causes are trauma, Marfan syndrome, Weil-Marchesani syndrome, or homocystinuria. And for dislocation, the symptoms would be, of course, blurred vision because the lens is not in its position. But if it is in the anterior chamber, they can also have secondary glaucoma and result in pain and redness. Again, the most common cause for dislocation is trauma, right? In posterior dislocation, the symptoms are blurred vision. So there is aphakia, so the patient will have aphakic kind of vision. Now, what is the shape of the lens? The normal shape of the lens is biconvex. Okay, so but this can the shape of the lens change? Yes, if it is it can completely become spherical, which is called as spherophakia, where you see the margins, where you see the equator of the lens. Then now the anterior surface of the lens can be more conical, like when we see keratoconus, we say the cornea is conical, whereas here the lens is conical, lenticonus, but is more commonly seen in Alport syndrome. You can also see that the posterior surface is conical, which is also called as posterior lenticonus, and this is also more common in Alport syndrome. Or there can be a notch in the lens where part of the lens is missing. Okay, this is more common in the infero-nasal quadrant, which is again probably associated with coloboma of the iris or coloboma of the retina, and this is called as this is seen as a notch in the lens. Okay, the next is the color of the lens. The normal in the normal eye, the lens is clear, transparent, right? So when we throw light, we just see it as black in color. Whereas in cataract, if it is a cortical cataract, we see it as grayish white. This whiteness or grayness might vary depending upon the stages of the cortical cataract. If it is an immature cataract, is grayish white. We'll again see through it. If it's a mature cataract, it's more pearly white. And if it's hypermature cataract, it can be If it's a Morganian type of hypermature cataract, it can be milky white. If it's a sclerotic type, it is dirty white. In nuclear cataracts, depending upon the grade of the nuclear cataract, it can be yellow, amber, brown, red, or black. In pseudophakia, how do you see? You see that it is black with shimmering reflexes. We'll see these in the following slides. And in aphakia, it is jet black. Please, when you in a normal lens, don't say normal clear lens, don't say it is jet black. And some of the students in pseudophakia also describe it as jet black. No, in pseudophakia, you will describe it as black with shimmering reflexes, and in aphakia, it is jet black. Okay, so cortical cataract, grayish white and senile immature cataract. So this is how you'll see. It is not clear, but you see a grayish white opacity. Pearly white in senile mature cataract. This is how you see it's pearly like a pearl, right? In hypermature Morganian type, you see milky white in the upper part, and in the lower part you can see the sunken nucleus, which has its color depending upon the grade of the nucleus process, or it can be dirty white like in sclerotic, where you see dirty white cataract. Now, in nuclear cataract, you see grades of yellow. I mean, no, because of protein denaturation, you'll either see yellow, amber, and as it progresses, you can see it as brown, red, or black. Brown cataract is called cataracta brunescens, red cataract is called cataracta rubra, and black cataract grade 5 is called cataracta nigra. Right? Now, black with shimmering light reflex. Where do you see pseudophakia? Please remember, when a patient has been operated and a posterior chamber intraocular lens is placed, you see like this. When you throw light, you will see the second and the third and the fourth Purkinje images, which when you move the light across the pupillate area, you'll see that they are also changing position. This is how you'll see. You'll see these shimmering light reflex on the lens. That is pseudophakia. Jet black pupil, aphakia, you'll not see anything. Even the torchlight is not seen, because you don't see the Purkinje images, you just see it as jet black, and when you see that, you will describe it as aphakia, right? Now the next thing is iris shadow. What is this iris shadow? So in an immature cataract, so immature cortical cataract, when you pass light, you see that some light passes through the clear fibers. There will be clear fibers and opaque fibers. They'll pass through the clear fibers, and the iris will form a shadow on the opaque fibers. That's when you see a iris shadow on the lens. The shadow of the iris is forming on the lens. So please remember, most of the students get confused with iris shadow with the eclipse sign seen in shallow anterior chamber. Please don't get confused. Iris shadow is seen on the lens. It's a shadow of the iris falling on the lens in case of senile immature cortical cataract. Okay. So when oblique light is thrown on the lens, iris shadow is formed if there are clear fibers between the iris and the opaque lens fibers. So iris shadow is seen only in immature cortical cataract. Iris shadow is not seen when the lens is totally clear, where the lens passes through all the clear fibers, or if it is opaque. So there are no clear fibers between the lens, between the iris and the opaque fibers. So it cannot form a shadow, right? So iris shadow is seen only in immature cortical cataract. Now let's see how do you see iris shadow. If you throw light from the temporal side or from nasal side, if you see this, this is the shadow of the iris forming or the pupillary margin. So if I'm throwing light from here, from the temporal side, I'll see the iris shadow on the temporal side. If I throw light from nasal side, I'll see it on the nasal side, right? So this is a dilated pupil, and you will see it more clearly. If I throw light, this is the iris shadow forming on the temporal side, right? Now, if the same thing on the nasal side also, if I'm on the left eye, if I throw light from the temporal, whichever side I'm throwing, I'll see a iris shadow because there are clear fibers between the iris and the opaque fibers of the lens. This is how you see iris shadow. Grayish white pupil, presence of iris shadow, your impression will be senile immature cortical cataract. So in summary, we'll talk about the position, shape, color, iris shadow. Please remember, you don't have to say position of the lens normal, shape normal, color normal. You will just say when you're describing the lens, you will say, if you're seeing a clear lens, there's no, I mean, if you're just seeing black, you say clear transparent lens seen. or if you see a grayish white opacity, you see examination in the examination of lens, you'll say grayish white opacity with iris shadow present. If you see pearly white opacity, you'll see pearly white opacity with no iris shadow present. And if it's a hypermature cataract, you will describe it as a milky white lens, or a sclerotic, dirty white sclerotic lens suggestive of senile hypermature cataract. And again, mention the color of the lens, and if immature, mention that the iris shadow is present. Again, here in this case, when if it's mature and hypermature, please comment iris shadow absent or no iris shadow, because that is one of the differentiating feature between a immature stage and the mature or a hypermature stage. Okay, you don't, unless the position, shape, and it's abnormal, don't mention about it. It's fine if you just stick with color and presence or absence of iris shadow. In case of pseudophakia and aphakia, please don't say shimmering light reflects present, iris shadow absent. You're not expecting iris shadow there, so you don't have to say that. You just say shimmering light reflects present, suggestive of pseudophakia. In case of aphakia, you say jet black pupil, suggestive of aphakia. So that's how you present the lens examination findings. Thank you very much.